All right, I'm seeing these IV hydration and IV therapy centers pop up left and right. I mean, the numbers are like increasing exponentially. I'm seeing them everywhere. I needed to do a video about this. We're talking about IV hydration, IV therapy, the type that's given in these sort of centers or places that will give IV fluids, whether it's normal saline or a mixture of normal saline with vitamins, minerals. Sometimes centers are mixing it with other medications like anti-nausea medications, sometimes pain medications, and oftentimes these centers are billing this IV therapy or IV hydration therapy as a way to become more hydrated, to like hangover cures. Like if you have a hangover, come get IV therapy. You'll get more energy. Some places are saying, hold on, I have a list. Let's see here. You can get vitamins more effectively this way. Some are advertising them as a way to treat COVID. They are not, by the way. Spoiler alert. Let's see here, I mentioned energy. So there's a lot of claims behind these centers that are opening up these IV hydration therapies in terms of what people will get. I wanted to come and talk about my thoughts about this, okay, as a family doctor and what I think about these centers. First of all, it's amazing what keeps popping up, I have to say. When I first saw these, I was like, what is going on? So let me give you my perspective very quickly as a family doctor, and then I'm going to go through sort of my pros and cons about these IV hydration, IV therapy places, okay? First of all, the only setting in which I deal with IV fluids as a family doctor is when I'm sending someone to the hospital or when I worked in hospitals and was treating patients, okay? And one of the things I have often said and still honestly feel, you'll probably get an idea of how I feel about this, is that if you truly need IV fluids, then you likely need a hospital or a medical setting, okay? And I do feel that way. But, okay, let's go through sort of the pros and cons. First of all, first thing is that with these IV hydration centers and things like that, they're offering, like I said, normal saline, sometimes saline with vitamins, minerals, B complex vitamins, vitamin C, other things as well, that are advertising these things for hangovers, for hydration, for energy, etc. First of all, there's not a lot of evidence that, we don't have much evidence, I don't think at all, that IV hydration with these sort of things will help you get more energy or will help you do this or help you do that, okay? So that's the first thing. When we are using IV fluids in the hospital, it's for a very specific medical reason. They are dehydrated, okay? And yes, normal saline will help hydrate you, but hold on, I need to say something about that, okay? So yes, you will get hydrated from it, but hold on. But in the hospital setting, yes, IV fluids will help you not be dehydrated, will help give you medications, life-saving medications that you need, may help give you antibiotics and other things. It's a whole different context. It's a life-saving sort of important and necessary context where we have evidence that those things in this context actually work. In the context of these IV hydration centers where they're saying you'll get more energy, we don't have a lot of evidence that, a concoction of normal saline and some vitamins, et cetera, will do that. First of all. Number two, and this goes back to what I was just saying about the hydration, because some of you might be saying, but yeah, well, you will get hydrated if you go to these IV hydration centers. You're going to get fluids. You're absolutely right. You really are. But this is the thing. In the absence of other medical conditions, for most people that are healthy, that are able to take food and water by mouth, and I mean that's literally, like you don't have any stomach issues or gastric or gastroparesis, you don't have any issues, surgical issues, whatever, you're able to eat and drink by mouth. For most people, we don't need IV stuff to give us hydration. We can just go and get some water and drink it, okay? You are right that if you get IV fluids by an IV, you will become hydrated. My point is that you don't need an IV to be hydrated if you are healthy for the most part. You're able to eat and drink by mouth, et cetera, et cetera. You see what I'm trying to say? You can just eat the vitamins and minerals that you need from a well-balanced, healthy diet. You can drink the fluids that you need. Please keep that in mind. That's very important. When someone is sick, when they are ill, they're in the hospital, that's a very, very different situation. They may not be able to eat and drink their way into hydration status or whatever, okay? Because they are sick, all right? The next thing is, it's expensive. It's a lot of money, these things, especially when most of the minerals and vitamins that I've seen that are offered can be gotten by eating a well-balanced diet, healthy diet with drinking fluids, okay? Now, again, some of these centers do offer medications and things like that, but if you need something for nausea, there are over-the-counter nausea medications. If you need something for pain, there are over-the-counter pain medications. Just saying. All right, next thing is, I'm not sure how well regulated these centers are. Like, and this I really am just not sure. Okay, if somebody's watching this video and can give you some insight, let me know how well regulated they are. I don't know what the oversight is like. And that's going to bring me to a point that I'm going to make later on about safety. Okay, I'm not saying that these are not unsafe, but I do want to make a point about that. Let's see here. The next thing is, some people really should not get IV fluids, okay? Unless in certain situations. If you've got kidney problems, if you've got failing kidneys or kidney damage, if you've got heart or lung problems, congestive heart failure or other things, your doctor may have you on a fluid restrictive diet, meaning you can't take in a certain amount of fluids or more per day or per period of time for your own health, for your organs. IV hydration therapy is not right for everyone. And I have seen some IV hydration centers that do extensive medical intakes, which sounds like a good idea to me, to be honest with you, if you're going to do this. But then some that don't seem to have as extensive of an intake. So you got to keep that in mind. I'm also not sure who's making the medical decisions as to who can get this IV hydration therapy. I just don't have a good aggregate of data for how this works, but understand that not every patient or every person is a candidate for this in the first place. All right, the next thing. Let's talk about some risks, okay? Remember that there are potential risks to anything that's invasive. So any sort of IV, right? Even though it is a relatively, it's a very common procedure in the hospital and in medical settings and drawing blood and things like that. But the thing about it is there are some small risks that are real, right? There can be infections at the site of IVs if they're not done properly or if they're contaminated, etc. Also, you can actually get blood clots at the site of IVs and things like that. That's one of the reasons why I say I'm not exactly sure of the oversight. This is not a judgment. It's just I'm not really sure. You want someone who's competent and who's qualified for doing IVs and can deal with and manage potential risks. What might happen if something bad happens, right? So these are things to think about and sort of questions I have, but understand that there are potential risks for getting an IV. And if you can just get some of these things by eating or drinking, it's less risk, to be honest with you. So keep that in mind. As I said before, my personal feeling as a family doctor is that most people who are able to eat and drink by mouth and who are relatively healthy probably do not need something like this. They can eat or drink the nutrients and the liquids and stuff that they need. And that's very, very important. As a family doctor, once again, from my perspective, if you truly, truly need IV fluids, in my opinion, you also probably need a hospital, okay? I'm not saying not to do this. I'm not saying it's going to be harmful or that it necessarily is harmful. That's not what I'm saying. What I'm saying is that I do believe that there are potential risks versus benefits. I think that if this is something that you want to try, something that you want to do, look, I always say run it by your doctor. Some of you guys write and say, well, what's my doctor going to say? They don't know anything about this. Well, it's for another opinion, okay? Get their opinion on it. Don't just take my opinion for it or other people that you might see on social media. Get your own doctor's opinion. Get another medical professional's opinion. Again, for most people, I don't think most people need this, okay? Also, I recognize this is a business. I'm not out to bash businesses, but I want you as a consumer to make the right and the smart decision for you. Look at the different sides. Look at the potential pros and cons. Think about your underlying conditions. Think about your wallet. Talk to your doctor. See what actually makes sense for you, rather than sort of just going on a bandwagon of what we're seeing. Once again, for most people, you can get your nutrients and proper nutrition and hydration, etc., from what you eat and drink. And this was a solution created for problems that, in my opinion, already had solutions available, some of which might be less risk, perhaps less expensive. Food for thought. Take my food for thought and add it to others. I know this is an opinionated segment. I'm not always this opinionated, but this is my thought. Opinions can change. If I change my mind or if I get other evidence or whatever information, I will come back and let you know. I want you to let me know what you think in the comments. Even those, and there are doctors who have IV hydration centers. Absolutely. I have seen this like in different practices and stuff like this. So doctors and healthcare professionals, please weigh in. Let me know your thoughts. Let me know, what I'm missing. If there's other sides I have not considered, I do want to know that. Okay. But the most important thing is talk to your doctor to find out what's right for you. Guys, I'm Dr. Jen. It's great to see you. Please on Facebook, like and follow my page. For those of you who send stars, thank you so much. Consider joining my exclusive groups for membership groups for exclusive content on YouTube. Please subscribe to my channel. Click the little bell for updates and check out drjencaudle.com for my free health newsletter and so much more. Guys, I love you. Let me know what you think. Share this video with others. All right. Mwah.